Hi, everybody. It's Amy Diamond here with the Deal with Diamond Group at App Properties. And today I have a special guest with me. This is Dr. Nakfoor with Nakfoor Orthodontics in Arlington Heights. Hi, Dr. Nakfoor. How are you?
Hey, Amy. How are you? Good to see you again. We also have a place in Park Ridge, too.
Oh, Park Ridge and Arlington Heights. Well, there we go.
Yeah.
So on that note, why don't you tell me a little bit about your new office? I mean, I've been there. It's stunning. My son is obviously been going there, and I'm sure you're ecstatic about your location. So talk to me about it.
Well, we're beyond ecstatic about the location. It's the old Clemente's restaurant, which any of you that have driven past it for about the last 5 years have noticed this site has gotten pretty run down and really left to go to waste. So we were very excited when we were able to get it and move from our location in downtown Arlington Heights. We put a lot of money, a lot of pride, and a lot of effort into making this into a very warm, family-oriented office and practice. We have a fireplace even when you walk in. Mm-hmm. We also got really lucky with this move because in our old office, we would not have been able to do orthodontics with COVID when it came up. We actually have a lot more space. We're able to do the social distancing. And we like to think that it's now a little bit of a gem here on Northwest Highway.
Yeah, and the parking is so much better too. So.
We went from 8 spots to 28 spots. So yes, everyone's much happier about that.
Absolutely, absolutely. So you mentioned you wouldn't have been able to do it with COVID in your old office. So this new space is allowed for more social distancing. So walk me through some of the precautions that you guys are taking on that front.
Sure. Luckily in dentistry, we've actually been following a lot of the precautions that they've put into place for everyone else for over the last 20 years. Now we have had to increase a few different things and do a few things differently. Every single person that comes in the office gets their temperature taken. We do have a small questionnaire, and everyone's pretty familiar with those now, that they have to answer to make sure that they haven't had exposures to it. Right. We have brought in some extra air filters into the office. One of the other really nice, neat things about this new office is we have some private rooms. So in dentistry, not so much in orthodontics, but in dentistry, we create an aerosol when we use the handpiece. In orthodontics, we do that when we're taking off someone's braces or their Invisalign attachments. So I have 2 private treatment room areas that we're able to put the air filters in directly that really controls the environment for when we do have to do those procedures. The other nice thing is we actually schedule those all on one day so that we're really confining any potential exposures to that one area. So it takes great care of that. One of the other great things that we've also done recently, well, we've actually had the capability for a while, is virtual consults through our website. Mm-hmm. So if you go to our website, which is nakforsmiles.com, you're actually able to schedule a consultation that we'll do over Zoom, kind of like how you and I are talking right now.
Oh, nice. So the patient doesn't even have to be in front of you.
If they have those concerns, they don't even have to come in. Exactly.
Perfect. Perfect. So when we were there for our consult, we talked about braces and Invisalign during mm-hmm. that consultation. And I know that you are a big proponent of Invisalign, and I believe you have your practice is one of the top that sells Invisalign, that's, supports Invisalign. Why is it that you're such a believer in Invisalign versus braces? And maybe walk people through it, because I don't think a lot of people know what Invisalign is. I mean, I was just acclimated to it because of my son going through it, but
sure. Well, before I really get to the differences between Invisalign and braces, let's talk about kind of experience and levels with it. Right. I'm what's called a Diamond Plus provider, so kind of like you with Diamond and Realty. Everyone knows that anything that involves diamonds, it's always really good and really special.
Yeah.
What that means is that I'm in the top 1% of all providers of Invisalign in the United States and in the world. So I do more than anyone else, pretty much. Experience matters. And anytime you're dealing with any health professional, experience matters. You know how to manage and control and provide those types of services. So I've been doing orthodontics for about 20 years now. The Invisalign product is very similar to braces. What a lot of people want. A lot of people don't want to have anything seen in their mouth while they're going through the process. Now with masks, we don't have to worry about that quite as much.
Right. True.
It is. We tell people, unmask your smile once you're done. Go through it right now. And take off your mask. Everyone will see you have a new smile. Not about 95% of all cases in orthodontics can be treated with braces or with the Invisalign product in the hands of the right provider. That's being me. People want the Invisalign. That's why I learned how to do it. There are specific cases that I only want to treat in Invisalign because we'll get better results than we will in braces.
Like, what would that be?
Now,
What would be an example of that?
It's for someone whose teeth in the front don't even come together. So
Okay.
what's called an open bite, where they don't have an overlap of the teeth in the front. That one I specifically want to use the Invisalign product because it gives a better result, better control. Now, big differences between Invisalign and braces. Braces, once they're put in, they're in. You're not taking them out, and you have to use them to get through things. Invisalign, you can take them in and out. You can eat whatever you want. You got to remember to put them back in, though. That's the one little caveat with that. So that's one of the biggest things, and it's what a lot of people are asking for. There is a vast difference of a diamond provider versus someone else. The biggest thing for me and my difference from everyone else is I create a customized treatment plan for every single patient that walks into my office. It's no cookie cutter. I'm not just sitting there and I'm not letting the people who at Invisalign that set up the cases dictate what's going on. I'm dictating what's going on, how the teeth are going to be moved, what the results are going to be.
Yep. One thing I will piggyback on that is that the customized plan that we've seen just personally is that my son got 26 weeks worth of trays. And if you are a family that is worried about going in and out of office spaces because of COVID or seeing the dentist so often, because with braces, I remember you have to get them tweaked every so often. The Invisalign plan is set for 26 weeks. And I don't think we're seeing you for like 3 months, which if you have a child that it's right for, who is responsible, it's a great option for somebody who doesn't want to go in and out of their house, in and out of the practice, but also it's all set and it's customized to him or your child or your.
Well, it's actually customized to anyone. So it doesn't matter if it's a child or not. We treat patients from the ages of 7.5 to 91 years old in Invisalign.
Love it.
One thing that we offer, and we actually had this going on for about the last year now. We don't have it on every patient, but a lot of patients want it. As long as you have a smartphone, you can have it. It's something called dental monitoring. And what that is it is a way to scan your teeth with the trays in and with the trays out. And we are able to check every single week your progress to make sure that you are on track. So whether you have 12 trays or whether you have 50 trays, depending on that customized plan for you, we're able to follow you and track you, which does make your time more valuable because you don't have to spend a lot of time in the car coming to see us, but we're able to follow you closer.
Yes. Well, I love the extra technology and just being on top of what's happening in 2020. I mean,
well, we're very proud of that. We are 100% digital office and have been actually for about the last 3 years. For us adults that remember going to the orthodontist when we were kids, the goopy impressions, all of that, for the last 5 years, we've actually not taken a single impression. We actually use scanning technology that allows us to 3D print the models here in the office.
That's excellent. Well, kudos to you for being where you need to be. And so if anyone were to try to reach you and want any kind of questions or take advantage of any of your virtual counseling or appointments, how would they go ahead and reach you?
So there's 2 great ways to reach us. You can always give us a call at 847-392-0330. Or if you go to our website, nak4smiles.com. On the website, obviously, we have the phone numbers. There's a button there that if you want to schedule a virtual consultation or even schedule a consultation where you come in, you can actually do a live scheduling at any time of day or night. You can look at our schedule and see when you can come in. We actually are on Facebook and Instagram, and those links are through our website. I don't know them off the top of my head. I hate to say that's a little embarrassing, but
okay. I'm sure it's Nakfoor.
I can't know everything. I concentrate on the patient's treatment plan.
That's good. It's good. You need people for that. Perfect. Well, I appreciate your time. And if anyone has any real estate needs, as always, please reach out to the Deal with Diamond group here at Properties. I can be reached at 847-497-0230. And our Facebook group and Instagram pages are Deal with Diamond So again, thank you again, Dr. Nakfoor. It was always great seeing you, and hopefully we'll see you around town. All right.
Look forward to seeing you soon.
Okay.